record this part. I'm gonna make sure I end this Zoom call right at 11, so I will have some time to get that on Canvas for you guys so you can get started this morning.
Perfect, thank you.
Yeah.
So Joe, so the next section of that, is that going to be work? The quiz is going to be due the Tuesday after we get back from spring break. So we have to work on it during spring break, or how is that going to work?
I think the way it ends up working is we don't get a spring break, but hold on, let me see. By the way, if you guys ever have questions about the schedule, okay. Oh. Did I do the dates wrong for, no, not everyone, that's right, because, shoot, I think I told you guys wrong last week though. Okay, hold on, let me look at what I did on about activity 6 and exam 2. So I'm sure all of you saw the actual due dates that I have on Canvas. I thought that we were not, that we decided we didn't have enough time to have a review week for every exam. So like the first exam, you had quiz 4 due the same day that quiz 1 or exam 1 was due. That is not the case for this one. So what I will do is, did anyone already take the exam and now they're really upset that they didn't use that time to study more? Have you guys taken the exam? Have any of you taken the exam? Okay. Okay. So I know a good amount of my students have already taken the exam 2. For anyone who is, if you are upset about thinking that you had more time, I'm assuming that everybody saw the date on Canvas and went with that. But I did say in the Zoom meeting last week that both were due yesterday, because that's what I thought was on the schedule. So they must have changed it since I looked over that when the review weeks were. So this week is actually, we aren't supposed to start activity 7 until next week. I will still have it up for you today. Maybe that's why I haven't heard anything about it. I'll have something for you guys to start working on. I might update the information, and I probably won't put the quiz on until it's completely updated for this semester and all the bugs are fixed from the input we got from our students last semester. But I'll have at least some practice quizzes for you to start. But something I wanted to mention that is very important. If there is ever a time when either I don't have the updated information yet, so usually this is not going to be the case. where I have to wait from the department for the information for you guys to start taking your practice quizzes and your weekly quiz. If that ever happens, or if you somehow forgot or didn't take the quiz, the weekly quiz on time for whatever reason, and you are locked out of the next activity, there are tons of resources for you to use until you have access to that. So rather than just, oh, well, I can't do anything, you can go into slccanatomy.com and all of the resources that I have been giving you the links to make it easier for you to get to them, like on the resources page for every activity. But you guys can access that very easily and start. And if you want to get farther ahead than what I have, that is also what you would want to do. But I had a lot of issues with some students who quiz 4 was the worst, and then quiz 5 was a close second, which really sucks because those are the 2 hardest quizzes that we have, like pretty much the whole semester. But I had some issues where students did not take quiz 4, and so they were locked out of the practice quizzes and the weekly quiz for quiz 5. If you were one of those people, or if this happens to you later in the semester, you should always go to slccanatomy.com and start studying so you don't get farther behind. You don't just sit there and wait for me, especially when I'm telling you that I'm behind on emails. You know that that's going to take me longer than normal to answer emails if you are trying to tell me, hey, I missed quiz 4, can you reopen that for me so I can take it and get access to the next activities. The practice quizzes are very useful, and that's why I have them there for you, but that is not the only thing that you can learn this information from. So I just wanted to make that clear. Also, another thing that I want to make clear is I give every student one exception to late work. So, and that is no matter what the reasoning is, if you just forgot, or if for some reason you had a brain fart and didn't remember that it was due at 5 instead of midnight because your other classes have things due at midnight or whatever, or something catastrophic happens in your life and you don't have the mental capacity, or you just didn't have time to take the quiz on time, for whatever reason, you get one exception for late work. So I will not dock you the first time you have a late quiz or exam, but anything after that will be docked 50% or more, depending on how late you take it. And when you do take a quiz late, it needs to be within 24 hours of when I open the exam for you, or it won't count and you'll get a 0. Because I have to make things as fair as possible. And I will always assume that you guys are not trying to like lie to me or like pull one over on me or whatever you want to call it. But like, I'm not going to assume that you guys are doing that. But I have to think about all of the types of students that I have. And so if you are the kind of person who is willing to tell me what is going on in your life and I feel bad for you, it's not really fair for the for another student who doesn't feel comfortable telling me what's going on, but has something just as bad or worse going on in their life, but because they don't feel comfortable sharing personal details with me, I don't feel bad for them. I have to treat those two students the same. Does that make sense? So I don't want to give special treatment to someone who is willing to share more with me than a student who is not. So that's why I do the one exception no matter what it is. So if you just forgot one quiz and didn't take it, you take that one late, you get full credit for that one once you take it. But then later in the semester, something catastrophic happens and I don't give you the same, like I give you a 50% doc. Just realize that that first time is your one exception, like your one good excuse type of thing. Now, obviously, if there is something, an emergency that happens or anything like that, I might be willing to work with you, but because I have this class set up where you guys can work ahead, it would have to be something very out of the ordinary and very I don't know what the word is I'm looking for. A good reason for me to give you extra time. The thing is that no matter how bad I feel for you, I always care what you guys are going through. So if you want, like I appreciate you guys sharing things with me that are happening in your life. So don't stop doing that if you are and want to tell me what's going on. But I also have to think of your, extenuating circumstances. Thank you, Christine. I have to think of your long-term success in this class also. And so no matter what's going on in your life right at that moment, if I give you more than a couple days to get things worked out and get that quiz taken, then you're just going to be more and more behind the whole rest of the semester. So that's my situation there. So I had a ton of students contacting me about taking quizzes late or exams late or whatever. So I wanted to take some time to talk about that. So today, since we are not scheduled to take or to start activity 7 until, where is it? I just had this tab open. Where did it go? So activity 7 isn't scheduled to start until after spring break.
Is that when it starts? I thought that was
when it starts.
Was due on March 15th. Is it due March 15th? Or that's when it starts?
No, it starts March 15th. So for my class, because I give you an extra couple days because of when the semester started, ours wouldn't technically start until Wednesday the 17th, but I will have things ready for you. I'm hoping to have everything ready today, but I have to check with the person who's doing the finalization of everything to see what he has completely done.
Sorry, Joe, one more question. I'm trying to get my dates down so I know what I need to study. So
okay, all dates, just go on to slccanatomy.com and go to the calendar, and anytime it shows that, so they have due dates on Sundays, but our due dates are Tuesdays. So 2 days after what it shows on the calendar, but it will always be within that same week. So it shows that activity 7 is starting Monday, March 15th, but technically we won't be starting that until, I mean, if you're doing week by week, we aren't scheduled to start that until the 17th. However, like I have mentioned many times before earlier in the semester, you will want to get ahead as much as possible. Activity 7 is probably not going, you'll want, I mean, if you're working and studying through spring break, then you will probably be able to get activity 7 done early and move on. But that is a really difficult activity as far as how much information you have to know. It's activity 7 is the brain stuff. It's the brain and cranial nerves. So all of the parts of the brain, you have to know how to identify them, and then you also have to know what they do. And that's also with the cranial nerves, the 12 pairs of cranial nerves. And you not only have to know how to identify them and what they do, but you will also need to know the foramina that each of those go through. So it's not going to be as overwhelming as activity 5, but it is a lot. There are some people who think that it is harder than activity 5, but that's usually the students who really, really enjoyed learning the muscles. But most students enjoy learning stuff about the brain because it's super duper interesting. And some of the terms you've already heard before, like the lobes that you're gonna need to know. So, but just like with every other week, just a little bit at a time, go general and then down to the nitty-gritty details. So the activity 7 quiz is due, it starts, technically it starts the 17th. So a week after that is when your quiz is due. So just look on slccanatomy.com, and the calendar starts the week on Monday, but we start our week on Wednesday. And then how many questions, Aaron, how many questions for what? There will always be the same number of questions on every weekly quiz and every exam. So what was it? 40 questions for the exam one? Let me double check. 48 questions. Oh, right, because they're 2 points each and it's 94 points. Total. No, sorry, it's 47, but then there's that one extra one at the end. So it shows up on my to-do list where you guys can write me little notes. Some of you write some really funny things in there. I appreciate that. Okay, so okay, who said they had questions about the, what did you say, pelvic stuff?
Yeah, me. I just had os cocci was like the hardest one for me to get right on all the quizzes and the exam and stuff, because of all the different like angles you could look at it from. So that's just something I was hoping that we could review.
Okay. Yes, for sure. Okay, Christine, is there a particular part that you have a harder time with or that you want to start with, or what are you thinking?
Mainly the ischium and pubis parts, where they meet, like where they come together and what is what on those. Okay.
The easiest way that I have told students to split the 3 bones of the os coxa is when you are looking at the lateral view, so you can see the acetabulum. You know that's lateral because that's where the femur has to hook in. So you can see the acetabulum and the obturator foramen. Those, because they are between multiple bones, get parented to the os coxa. Those are the only things that get parented to the os coxa. All of the other things are not between 2 bones. They are on their own bone. So you parent them to either the ilium, the ischium, or pubis. So if you take the acetabulum and you divide it this way, right in half, right through the middle, as when you are looking at this anatomically correct, that would be a horizontal plane, a horizontal cut right down the middle there. That separates the ilium from the lower parts, the lower 2 bones. Then from that line that you just, your imaginary line that goes through the middle of the acetabulum horizontally, you're going to make a T, a capital T, that starts from there and goes down the middle of the acetabulum again and down the middle of the obturator foramen. And then that will give you a really good guide of which of your line or your suture, where your suture would be. You can't see the sutures on the os coxa of the 3 different bones because they form so early on in development. It's really difficult to see those. And then, so now I know that everything posterior to this vertical line that I am making, or the sagittal cut that you make in your imaginary, you imagine a sagittal cut, then everything posterior to that is going to be the ischium. Everything anterior to that is going to be the pubis. Saying pubis or the pubic bone, same thing. Ischium or ischial bone, same thing. Okay, so usually the parts that students get confused are the rami. So you have one ramus on the ischium, and then you have 2 on the pubis. So the difficult part ends up being, so the ramus, a ramus is, does anyone remember what ramus means? Yes, branch.
With angles.
Yeah, so usually they come out at an angle, but it's what it means branch. So it's off of the body of the bone, and it is like a portion that juts off of the body. So it's like the body is the trunk, like if you're imagining a tree, and then the ramus is the branch that comes off of it. And so right here is the body of the ischium. And then you can see a flatter portion on the more medial view. And so this thing jutting out right here from the body is the ramus. And so there's only one on the ischium, so you just call it ischial ramus, or ramus of the ischium, or ramus of the ischial bone, or however you want to say it. That comes right up, so remember you're making your imaginary line right down the middle that goes down the middle of the acetabulum and the obturator foramen. Right on the other side of this ischial ramus is one of the rami of the pubis. So right here is where the body of the pubis is. So you have this branch that comes out and this branch that comes out. So you can't call both of them pubic ramus. So you have to tell me what the difference is. So what is the difference between this ramus and this one? This one is more what than this one? Some of you are saying it or motioning. Yeah, it is more superior. So this is the superior ramus of the pubis and inferior ramus of the pubis. And you have to remember, so the arrow won't ever be like right on the line of where it will be as close to the body as we can get, so it's clear which bone it is on. So you don't get it mixed up with the ischial ramus, if you don't get the inferior pubic ramus mixed up with the ischial ramus. So just pay attention to which side the arrow is on. Is it on the ischium or is it on the pubis? What else do you guys have issues with? Did we talk about the iliac crests? I mean, not iliac crests. The this is the iliac crest up here. I mean the spines. So you have 4 iliac spines. Spines are little, usually like thinner pieces of bone that come out. It's really similar to a crest, but it kind of looks like a spinous process, like on the vertebrae. So because you cannot call all of these iliac spine, you have to tell me what the difference is. So you first tell me if it is anterior or posterior. I know that this is anterior on this side because the pubis is anterior, right? So the ones that line up with the pubis are going to be anterior. The ones that line up line up better with the ischium are going to be the posterior ones. But you have 2 on the anterior and 2 on the posterior. So because you can't call both of these anterior iliac spine, you have to give me another term that distinguishes these 2 from each other. So once again, it's superior versus inferior. So you're going to call this one anterior superior iliac spine. This one will be anterior inferior iliac spine. So what will this one be back here?
Posterior superior iliac spine.
Yes. Posterior superior iliac spine. So be careful because especially in your stress brains, you're going to want to say a bunch of anatomical terms together that don't make sense. Like you can't say anterior posterior because that is saying that it's both on the anterior and the posterior side of that bone, which it is not, right? So you have to explain to me where they are. And that's why, and I always tell students to remember this one first as the as is. That's a really ASIS. That's a really common way to reference this part of the bone. And that helps you remember the order you're supposed to say them in. So ASIS, as is telling you anterior for A, superior for S, iliac for I, and spine for S. So as is. And then that will help you remember how to say the rest of them if you have a hard time remembering the order. Always anterior, posterior first, and then, so you're telling me the difference between these 2 and these 2 first, and then you're telling me the difference between these 2. So this one compared to this one is anterior, and then, okay, there are 2 that are anterior, so this one is anterior superior. Does this make sense? Is this helping? Christine, what else would you like to go over?
That you hit it pretty much at the beginning, where the ramus, where they meet and like splitting it. That I think that's what I was having trouble with, like, because there's so many different pictures, like when it's like all together pointing to it and stuff like that. But that little review just, it helped.
Did I tell you guys my trick to determining right from left for the os coxa? So it's not the same if you can't have the bone in your hand, but if you have been to the open labs or into the libraries and checked out the bones and you've been able to hold them in your hands, this one, the os coxa, you can hold it in your hand. So right here, that greater sciatic notch of the ilium fits really well in the crook of your hand right here between your first and second digits. And you can hold it up to your face like a phone. Like you have to think old style phone for this. So like back when they used to use operators. So you talk into the phone, into the obturator foramen, and you say, hello, obturator. And if you try to switch it to your other hand, so the acetabulum needs to be pointing out because that's lateral, right? So if you tried to put this one, so this one is a, somebody tell me, which side is this one? So this is the acetabulum. This is the greater sciatic notch.
Left.
That is a left. So if you tried to put that in your right hand and you put it up to your face, first of all, the iliac fossa doesn't like curve in like a phone does, like old style phones. Sorry, 90s or born in after the 90s, you probably don't know what I'm talking about. Ask your parents or YouTube it, it'll show you. But then you also have the acetabulum in your face. Nobody wants an ass in their face. Well, maybe, I mean, no kink shaming, but not in anatomy class when we're trying to learn. Save that for later. So that's how I remember left from right on. Did you guys get asked any left or right questions on bones? I know it doesn't seem like it to you guys, but it's a lot easier to take this class online than it is when we're in person. Although you do have the added benefit of having things in your hands more often, and that does help with learning. Okay. Does anybody have any other questions about the os coxa before I leave this stuff? Okay, so tell me then, how are you going to orient yourself from this picture? Because this is a different view than the other one that we were just looking at. So how are you going to determine what you're looking at? How would you describe this portion here as far as anatomical directional terms? Like where is this positioned on the body? Like compared to the rest of the bone? Is it more superior, inferior, medial, lateral? And I don't know is an acceptable answer. Okay.
Isn't that the medial side?
Yes.
So the arrow would be pointing at the anterior, inferior iliac spine.
Yes, that is correct. The way that you know you are looking at a medial view is because you can see the auricular surface when you're looking at the medial view, and you can see the iliac fossa. Iliac fossa is not quite as easy to determine between this side and the other side, so I always look for the auricular surface. It's this really bumpy part that's easy to identify. The back, or the lateral portion of the ilium is a lot more smooth all over, right? So that's how and you can see when you go down this way, you can see the acetabulum when you are looking from a lateral view. So those are the two things you're going to want to determine medial from lateral view. And then you can orient yourself. And so you know, and then the other thing that you can use is this pointy part. Remember, you don't want to sit on something pointy, right? That would be really uncomfortable. You want to sit on something really nice and rounded like this, right? So that is going to be posterior, where you sit, and this pointy part is going to be anterior, where your pubic bone is. And you point that at other people sometimes. Okay. Okay. So tell me what view this is. Is this a lateral or a medial view? Yes, that is a medial view because you can see the auricular surface. And remember, this auricular surface meets up with the auricular surface of what bone? What bone did you learn in the previous activity from this one that also has an auricular surface in this region or this area?
The sacrum?
Yeah. So auricular surface of the sacrum, auricular surface of the ilium meet up together. And that's where, so bone on bone will usually appear as this really jagged look. Okay. Whereas when soft tissue like muscle and nervous and blood vessels and things like that, that's going to be smooth. Just like rocks on a mountain, like if you're hiking up a mountain, all of those rocks are super jagged, right? Like when you fall on them, you're gonna cut yourself for sure somehow. But river rocks that have a smooth surface of the water constantly going over it have that smooth appearance to them. Same kind of thing with bones. Jagged means it comes up to something else that is hard. So it makes that jagged appearance. And then using the greater sciatic notch is also another good way, the greater sciatic notch and lesser sciatic notch. So the ischial spine divides the greater sciatic notch and lesser sciatic notch. So the greater sciatic notch is on the ilium, the lesser sciatic notch is on the ischium. And that ischial spine, just like the spinous process or these spines here, come out with that skinny little thing, just like the spinous processes on your vertebrae. But those are also a good landmark to determine posterior from anterior. Okay. All right, what other questions do you guys have? I probably have time for one more question. And then I need to go so I can try to get some practice quizzes for you. I want on the recording. You guys all know, some of you have already seen that life happens and things happen that are out of your control. So the more you can get ahead of schedule, the better your stress level will be. And things get way more stressful at the end of the semester because you have finals to worry about, you have final projects to worry about, everything, and you have a ton of things due and on your mind at the end of the semester. So keep that in mind as you're going through spring break and thinking, hey, what can I do for anatomy to get a better grade? Start studying. If I can't get the activity 7 stuff up today, I will send out an announcement letting you know, but I should be able to get at least some practice quizzes up. And then once everything is fine-tuned, I'll have everything up after that. Okay. All right.
All right. Thank you.
Thank you. You guys have a good week too. Talk to you later.